Good afternoon or good evening from wherever you're watching from. You're welcome to yet another edition of our health awareness on this platform. Subscribe if at all you've not yet subscribed. That is, if at all you wish to share, you can share with a friend and share with a friend, because this is an important information that everyone needs to know and help each other to get out of it. Today, we are having an important guest, and that is, I think he will introduce himself. But today we are having an important guest, and that is one of the doctors at Diabets Medical Center. He's going to elaborate for us something that is so crucial and so important. He has informed me that today is a disease, and there is a celebration that they take, and in the hospitals and fraternity of health workers. So today I'm with you, Dr. Moses.
Yes.
You just help me increase some voice, and my viewers watch well. Now, the people that are on the channel, we're having Dr. Moses on the podium, and today we're going to talk diabetes. In my local language, they call it scan, and that has taken many people to another way of thinking about things. However, I want us to discuss it more, because they think of taking a lot of sugar will lead you to getting diabetes. So, first of all, I want us to elaborate what is diabetes. You know, in the local language, they call it sukari, and many people say, is it the sugar that we take or what? And what causes it? What is diabetes? What causes it? What are the signs and symptoms? What are the predisposing factors of this infection? Yes, I want us to discuss more and more, help these people to notice the signs and symptoms, to notice how they are feeling. But all the way they are feeling is in that way, in that lane, they should come to the hospital, do the checkups. How are they going to manage the way of that feeling? If at all they are diagnosed with diabetes, how are they going to live? So you're going to help us in that way.
Thank you very much, Mr. Emma, for this YouTube channel. For those who have not yet subscribed, kindly subscribe. My name is Dr. Moses. I work with the Diabets Medical Center in Konge as you are heading to Buziga. Today we are going to talk about diabetes because it is one of the non-communicable diseases or diseases of lifestyle, if I may say. One of them. There are many. On top of diabetes, there is hypertension, and many other cancers are also on the rise. But today we are going to talk about diabetes. And today, as I was discussing with Emma off air, it is the World Diabetes Day. Today's celebrations are in Calvary. That's why the Ministry of Health is based, to celebrate, to create more awareness to people in the community. How do you know that I'm actually having diabetes, and how can I go about it? So today, if you have a friend that could have this symptom that I'm going to mention, could have this disease already diagnosed, we are going to see more. What's diabetes? Let's start from there. Diabetes is literally, I don't want to go into more science.
Yes.
It is high blood sugar. Not just sugar, blood sugar, but it has to be high than the normal. Because there is a normal, everyone in us has sugar levels. But if they go beyond that amount, then that's when we say high blood sugar.
Okay.
Then actually pressure also. Everyone has pressure. But it's high blood pressure.
Yeah.
So literally when they say diabetes, you are meaning high blood sugar that has gone beyond the normal.
Yeah.
And it has several types.
Okay.
We have type 1, we have type 2, then we have what we call gestation diabetes. Gestation diabetes is when you get pregnant, then it comes because of the pregnancy changes. Then after delivery, it can dissolve, or if you have a high risk factor, it can actually pick up and you have diabetes.
Okay.
I am going to talk about diabetes, but there are key things that I want us to first understand how they work. Then we shall see how they lead us into diabetes. One thing in our body is what happens when you eat food. Like after taking this on, what has happened to your body in the normal sense. When you eat food, it goes within the intestines. Then there is what is made out of this food, what we call glucose levels. So the glucose is the sugar composition of, glucose is what is stored in blood, is what goes through blood and then it is stored in the muscles. So what we pick from the food that we eat is glucose. So that glucose is what we call the energy source for our muscles, what helps us to walk, to jump around, to drive, to kick, whatever the muscles need. To think, we need glucose. So it's an energy source, but not the only energy source. We can also get energy from fats, from muscles when they are broken down into amino acids. But the body, about 95% uses glucose. The brain uses glucose, the heart uses glucose. So when it goes into, after secreting the glucose, then it has to enter into the muscle, from blood into the muscle.
Okay.
So what helps it to enter into the muscle is what we call insulin. So insulin is a hormone that is produced by the pancreas. I don't know people there who can put it into Uganda, but pancreas. Mr. Emma will help us into that.
I think that is what they call akatago. I think so.
Akatago, yes. So that pancreas secretes insulin. It gets information from the brain. I don't have energy. That's why you feel hunger. The brain alerts you that when you feel hunger, meaning your glucose levels have reduced. So your brain is telling you, go and get food, go and eat. That's why eating process is a programmed thing in us. You can eat at any time. And that's why at lunch, when it gets to 1, people usually say it's lunchtime because it's programmed in them. So that time, insulin has to be secreted after eating. That's a normal thing. Like you eat, glucose gets into blood, but it has to be at a certain level.
Okay.
So that's why insulin comes in to push most of this glucose from blood into the cell. If it is too much in the cell that it is not going to be used now, it can be stored in terms of fat. Yes. So this happens that type 1, as I told you before, type 1 is more common in children.
In children. So you mean even children also get diabetes?
Yes.
Parents take care.
So we are going to look at from childhood until you deliver another baby.
Okay.
We are all at risk. But there are those who are more at risk.
So the question that I was asking, that who is at risk, we are all at risk.
Depending which category, I will break down the category.
Okay.
Type 2 is more into adults, 35 years and above. Type 2. And you cannot avoid type 1, but you can avoid type 2. Type 2 is more of lifestyle. So, who are the people at risk of type 2? These are the people who live a sedentary lifestyle. I'm an office person. All I do, drive my car to my office, sit, do my work, after go back home, eat supper, sleep. This day continues like that. So people who don't exercise are at a high risk of type 2.
Okay.
People who are obese. In medical terms, we term obese in terms after doing your body mass index. Body mass indexes, you have to know the person's weight, you know the person's height. I don't know, Mr. Emma, if you know your weight and height, and you're telling you, and you see whether you are obese or you are not.
Okay.
But if you do a BMI and you're above 30, obese, check up. You're at high risk of
getting diabetes.
Type 2. People who have a family history, your mom, your siblings, your jaja had diabetes, you're also at high risk. Then with type 1, why I said it is not in children and you cannot avoid it, because there's what we call autoimmune. Autoimmune is your body produces cells to fight against itself.
Okay.
So those antibodies are produced and they fight against the cells of the pancreas that produce insulin. So when the cells that produce insulin are no more, here you don't have any cell that produce insulin. You may have those autoantibodies, but they are stimulated by the environment. Maybe an infection, you've gotten like a viral infection, like hepatitis B. It comes in like mumps, you get that infection, or you get exposed like to extremes of radiations. So you find that your body cannot recognize that this is self. These are not my cells, these are not from my cells. So it damages those, what we call beta cells, are the ones that produce insulin from the pancreas. So when they are damaged, you are no longer producing any insulin. And remember I told you insulin is the key to enter glucose into the muscles. Okay? So with the type 2, rather type 1, that's how it comes about, and you can't avoid that. Yes. Then I told you there's gestation diabetes, which comes because of the pregnancy changes. Yes. So how will you know that actually what I have is type 1 or type 2? How does generally, how does diabetes present? It is so unfortunate that type 2 can go on unnoticed. You are normal, Mr. Emma, you are doing your work normally, but you go to the hospitals to do some of these other investigations, like check for your liver functions, to check for the urine. Actually, they find in urine there is glucose. Yet it should be 0 glucose in normal people. So when they find glucose, now they track backwards to find why is glucose in urine. And you find they are telling you all of a sudden you have diabetes. Yet you have been feeding no more. But then type 1 can come, especially if there are children, you are seeing they are not putting on weight, they are not growing very, very well. Children who are younger than 10 years, they are no longer susuling on the bed, but all of a sudden a child starts susuling on the bed. Now those are signs that actually could be signs of diabetes.
Type 1, eh?
Type 1.
Okay.
Type 1. So generally for diabetes, the presentation, someone is feeling excessive thirst. I won't tell you how this come about. He's feeling excessive thirst, he's feeling excessive hunger. Even after eating, he still feels hunger. He's urinating a lot, especially in the night. He's urinating so many times. Someone is telling you, Musao, I no longer sleep. I wake up like 4-5 times. Mr. Emma, you can bear me witness. You can't wake up more than 3 times in a night. Even if you have drunk a lot of water, you can't. Yes, because the body is designed to handle that state. Yes. So how does this come about? Because of the increased blood sugar in the blood. It pulls water as it is being excreted. As you are urinating, remember in blood, in urine there is glucose.
Okay.
So it goes along with
what?
With what? So like the way you put your salt or sugar overnight, in the morning you find it is wet.
Okay.
So it pulls water, goes along with. As it goes along with it, you are feeling more thirsty. Because the body tells you, no, I don't have water, add me water. You drink more water. you drink more. As you are drinking, it is going out. It is going out. Why people feel more hunger is that what brings what we call satiety. It's a long process, but in layman language, when you eat and glucose goes into the muscles, you feel energized.
Yeah.
So the brain gets informed that actually I'm full. But here the glucose is not getting into the muscle.
It is going within the blood.
Yes, it keeps within the blood because the key, which is insulin, this is in type 1, to enter it into in the cells of the muscles is not there. It is not being secreted. The cells got damaged. So it keeps in blood, and the brain keeps telling you, give me food, give me energy, give me energy. You are eating a lot,
but it's not going.
But it's not going where it is supposed to be. Eventually, another presentation comes in: weight loss. The person is telling me, Musa, I don't know what happens. I eat a lot. My child eats a lot, but cannot gain weight. Eventually, appetite is going to disappear, and actually you are getting into vomiting, into nausea, but that is on a lesser scale. So what happens in type 2 is you are producing insulin, which is the key
to changing.
Yes, to enter glucose. But the way you'll be having a key and a padlock. Our padlock is the glucose. Our key is the insulin. This time, you have the padlock, which is the glucose, you have the insulin very well secreted. The cells are okay. This is in type 2. But you put in the key patterns cannot match with the patterns of the padlock. Meaning we have what we call insulin insensitivity. It cannot be sensitized. Okay, it cannot enter to open the door for the glucose to enter into the muscle. So glucose will stay there. Rather the glucose will stay there because the insulin cannot open. The key cannot open the door for you to enter into your bedroom. So you have what we call insulin insensitivity.
So you have the key, but it can help you. It can't help you to open. It can't
open. Yes, because the insulin is supposed to be attached on receptors for them to open and then to enter the muscle. But this time it can't be recognized. You come as a child of the family. Who are you? We don't know you, yet you are the family member. So this is what happens in type 2. Yes.
So someone has insulin.
Yes, has insulin.
But it can't help.
In real science, in type 2, you find you can have a bit of reduction in the production of insulin on one end, but that is the smaller percentage. High percentage, you have good production of insulin, but it's not sensitive. It can't be encrypted or understood that actually, hey, my son has come.
Okay.
Yes. So still you go back to the same basics. You are feeling hunger, you are urinating a lot, especially at night, and also you are doing what? You are drinking a lot, and the thirst cannot go.
So in such a case, anyway, I don't want to go in front of where we are going.
Yes.
In such a case, what do we do and how do we collect? Okay, as we said, it is avoidable, as in type 2 diabetes, it is avoidable.
Yes.
Now, what do we do in that instance or in that case? If someone has a key, but the key is not being sensed by the padlock that this is my key.
Thank you very much for that question, and I'm sure also the viewers there were wondering, so what do I do to my padlock so that I open it and go to my bedroom?
Yes.
It will bring us into in terms of management. In management of diabetes, we can do what we call non-medical, medical. Nowadays there is what we call surgical also.
Oh.
Yes.
Okay.
And science has evolved. So in non-medical, if it is a person who is type 2, remember our viewers, I told you that with type 2, it will be an incidental finding. By the time you get these features, it has gone chronic. It has killed most of your body parts.
Mm.
Yes, because diabetes, it can make you blind. For the men, you can get erectile dysfunction.
The working bed reduces.
It reduces or even goes to zero. Because what it does, the sugars, is it goes into those small blood vessels, clogs them, and you no longer have a blood supply. And to get an erection, you must have blood supply.
Okay.
Yes. It kills the nerve that gives the sensation. So that's why also, again, they start having wounds on the legs. After from the wounds, the legs, you cannot feel them. Even when you are walking, you can't know you've stepped on a stone. You get those wounds that do not heal. There are so many out there, people who have wounds, but they have taken years, months, they are not healing. It could be a sign of diabetes. You got the extreme also, it can give you stroke. Yes, because of the diabetes. It can lead you to other diseases. It kills the kidneys. You find someone no longer passes out urine in relation to how much he's taking. You find Mr. Emma, there are people who can spend a day without susuling. Yet every time you are feeling thirsty sometimes, you have to keep in check. Are my kidneys functioning well or not? So diabetes, our viewers, can kill all your body parts. That's why I'm requesting that it is paramount to always do checkup.
Actually, I was going to say that.
Yes.
For those that are viewing, it is by either a health worker or a lay person or engineer, any person is paramount to doing a checkup at least after when?
At least every 3 months.
Every 3 months.
Yes.
Yeah, HIV is being given a period of at least every 3 months, but when you get someone, you do a checkup. But he is advising at least you do a general checkup, a general body checkup, at least every 3 months. Because we've seen that to note what you've been saying, we've seen that there is that one that goes unknowingly. You're not knowing that I'm in this situation until your body organs are being affected to the extreme. That's when you will say that I'm not.
Or accidentally they diagnose you with sugar in urine. But they have been doing a simple test like urinary tract infection screen, but they are finding glucose in urine. Yes. Then they are giving you news.
So it is mandate for us to start going for the checkups. You check up your diabetes, sugar levels, you check up your blood pressure, your status, most of the things like that. It is now a mandate because your health is your priority. However much you reach, when your health is not okay, then there is nothing.
When you run to make money without good health, you are making money for no reason. First, get in good health state. It is a health life that makes money. There are so many people out there with money, but they're
deathbed. Now, Doc, I want us to also elaborate more of the mothers. You know, there is that one that you said it can be brought about some conditions now, like pregnancy. The pregnancy-induced diabetes. I want us to talk about that because, you know, a mother may not know what is causing the diabetes, but yet she's not even going to the hospital. What what advices could you give to those mothers, and what are the signs that they would do see if at all they are to see the signs and go to the hospital maybe for a checkup? However, as a mother, you advise to attend antenatals every now and then because they do checkups. Those checkups.
Yes. Thank you very much for our pregnant mothers, or for those who are in that stage you are planning to conceive. You've already conceived, you have a friend. It is paramount that there is a specific weight you are supposed to have before you conceive, if you are planning a pregnancy. Anyway, these days people plan their pregnancy. They tell you in the month of May, I want to conceive. So it is good if you do what we call preconception counseling and treatment. So in this step, what we do is there are tests that you need to carry out before you conceive, especially if a high-risk mother, a mother whose weight is so much. It is if you are a mother who's also, you're already diabetic. Yeah, you can go to conceive, but you know you are already diabetic. So it is always good to do those tests. They know how is your sugar, how has it been controlled, so that your healthy personnel can know on how to manage you. There is no specific sign mostly in pregnancy that you are going to look at and say, I think this mother should be screened for diabetes. No, there's no that specific sign. But you look at the risk factors. If this patient comes tells you that I have an auntie or my mother herself was diabetic, then those are the candidates to screen. Though it is mandated that on your first antenatal you're supposed to do random blood sugar so that they know your sugar levels. Then if you already knew you are diabetic mother, then before pregnancy they're supposed to have control so that you get into optimum levels. When you're already conceiving, then you should be switched on to what we call insulin in case your sugar levels are so high. Then also for those that are already obese or the BMI above 30, it is also paramount that it should be screened, because diabetes in pregnancy, or what we call gestation diabetes, has so many complications that comes along. It can cause you to deliver premature. It can cause you to deliver a very big baby that you cannot push, or it is pushing you to a cesarean delivery if the baby grows very big, because as I told you, the sugar gets deposited into the muscles as in terms of fat, what we call adipose deposition of the glucose. So when they get deposited, then the baby grows big. So you find you cannot push this baby, you end up going for cesarean delivery. It can lead into intrauterine growth restriction, because if the blood supply to the baby is not adequate, then the growth of the baby becomes tampered with. It can lead into intrauterine fetal death. The baby dies before they deliver. These are the people who get sudden death of their inborn babies. Yeah, so this is what we call gestation diabetes. That's how it comes about. You're supposed to have a screening if you are in the risk group of the group I've talked about, so that you know your health worker plans your delivery timely before you get the complications I've mentioned above. Yes,
as I'd said that mothers are always advised to go for antenatals. And in antenatals, we do checkups, all the checkups. I think even Daphne Medical Center does antenatals very well. And I think with time we shall show you one day on their antenatals. And for the children, for the children, the signs and symptoms you've given us. However, it is advisable, yes, because in the children sometimes we delay also to notice that this child is being affected maybe by diabetes. So even the children are advised to be taken to hospitals to be checked up, I think.
Thank you very much. One thing is, if, for example, I told you, if you are born by a mom who had gestational diabetes, because after delivery it's a complication, they get what we call hypoglycemia. The glucose levels drop very fast because when the baby is in the uterus, he is receiving blood with high sugar levels. So what we call the pancreas of the baby starts producing a lot of insulin to match up with the high glucose levels from the mom's blood. So after delivery, this glucose level is cut off. So but the baby's pancreas still produces a lot of insulin because it's what is used too. But remember, now the baby is independent now. So these are the babies that we need to go into nursery for monitoring. Yes, so that can give a risk factor that this baby needs to be done follow-up to see how is the glucose levels of this baby. If you are born in a family with diabetes, it's good to do screening. If you notice those changes in babies, a baby who has not been urinating is now urinating on the bed, a baby is not putting on weight regardless of eating, or if a baby still is in pampers, but there is excessive changing of pampers. You know, buying like a piece of box of pampers that has about 80 pieces, but you are using them in 3 days. Every 30 minutes you are changing a pamper, and they are heavy, not just mild.
So the child should be taken for a checkup.
Those are babies that you go and do checkup. Checkup of blood sugar, it doesn't take even 5 minutes. Unless you are going for extensive tests after the preliminary one.
So it is for the mothers that have had diabetes. I know in the hospitals they tell you when you have gone for antenatals that you know what you're experiencing some diabetes, meaning meaning that after gestation or after that situation that has brought the condition, it can maybe subside or it can go away.
Even in the mom, she can pick up it now, she develops real diabetes. Yeah, but genuine it is supposed to drop, goes to normal. Yeah.
So then the body of the child starts producing a lot of insulin. I mean, a lot of
Initially after delivery, it keeps producing until now it is managed within the hospital. Then the baby is discharged when the body has stabilized. Now it knows how much of the glucose it is getting vis-a-vis how much insulin I'm supposed to produce.
So is there a way that child can be protected? You know,
the protection comes from antenatal. Doing antenatals early, most of you want to come
when it is 6 months.
No, first antenatal should be done immediately when you know you are pregnant. So that they manage you. Ideally, you are supposed to have attended pre-conceptual counseling and treatment. This is given before you conceive for those who are planning, so that they tell you first cut your weight to this level, reduce your weight to this level, eat this, eat that. If you have been diabetic, they treat your diabetes to normal levels. Then that is one way of preventing. Then during pregnancy, you are supposed to keep on insulin injection, so that it keeps within the normal range. For the viewers, those who remember, I told you that sugar can be stored in terms of fat. So that fat, that's why the babies of diabetic mothers are big. They can't be pushed, most of them. They are 4.5 kilograms, so they end up going for Caesar. I'm sure some viewers are saying, but may push the 4.5.
Yeah.
Yes, my sister herself pushed 4.2.
Okay.
But those are rare cases. Yes.
So now I want us to, you've given us ways of maybe protecting ourselves, of avoiding children from getting into worse conditions. Can we talk about the preventive measures that a person can do now in diabetes type 2, that one that you said that affects those ones that are old? Can we give the preventive measures that when we do this, we can prevent someone from getting the diabetes type 2?
Yes. Thank you very much, Mr. Emma. One thing I want to leave with viewers in terms of children, I just want those who have children to do a flashback of the morning schedule of their children.
Okay.
When children are going to school, what do you pack for them? In their bags, in their food container.
Okay.
What do you pack for them for breakfast at school? Or what is on your table for breakfast? Make that flashback. But we find much of the composition there lacks vegetables, lacks fruits, lacks a jug of water. When you are packing for the kids, we are giving them sodas, packed juices, so that they take. We are packing for them sausages to go to school, packing for them bread. They are good, but you're exposing them to high sugar levels. So this goes also to the old people. Our eating habits. This is lifestyle. I told you, when you do good lifestyle, you are good to go. What do you eat? If it is a plate, what is the biggest composition of your plate? At lunch, at break, supper. It has a lot of carbohydrate, meaning it has posho, it has rice, it has sweet potatoes, it has Irish, it has kalo, for those who come from West, and I think some Easterners eat kalo very much. Yes, yeah. It has kalo. You find someone is eating kalo or posho, he has their rice. There is no fruit. They are not vegetables.
They are all glucose.
That's all glucose. That's all glucose.
So what could a normal meal for an old person? Okay, we can start with children. Or what could a normal meal be?
A normal meal should have more of vegetables than fruits.
Enough.
Yes. We are going to talk about what we call diabetic plate model. If you're already diabetic, it is not advised. For example, tell my grandmother from the village, don't eat carbohydrate containing food. If you make a flashback in the village, the food that is there, matoke, rice, posho, sweet potatoes, cassava, kalo.
They are all glucose.
They are all glucose. Now, if you tell this mukade not to eat them, what will she eat? She's going to starve. So there's what we call a plate model in diabetics. You're already diabetic, yes. But how do you reduce on the amount of glucose you are taking? You get your plate, divide it into 3. The biggest section, half of the plate, should have vegetables and fruit. Vegetables can be nakati, cabbage, dodo, over broccoli, whatever vegetable, as long as it is green vegetable. Put them there. Have your fruits aside. Have a portion of carbohydrates, especially they recommend grains. How do you measure it? These 2 fists are enough.
of the
of carbohydrates.
Okay.
Then the proteins, we are meaning can be beans, can be nuts, can be fish, but also if you can measure 2 fish, when you put food on the plate, you can see.
Yeah.
We are not meaning you make a heap. No. That is a good food for a diabetic patient.
Okay.
Then exercise helps us to do a lot. That is, it helps increase the insulin sensitivity, reduces on the weight,
Yes.
and all those are preventive measures to diabetes. Exercise, we are meaning you can exercise 30 minutes per day.
Okay.
If you cannot, at least 150 minutes per day. We have what we call low demanding exercise, medium and high. Low can be walking,
Yes.
can be those people in the village digging, street is low to them. Then we are meaning these people who can go for running, for swimming, for bicycle.
Even swimming.
Swimming is a very good exercise because it puts all your body at work. Yes. Jumping the rope, these are the things you can do within your sitting room. Jumping a rope. Yes, but the exercise should be tailored to your physical fitness. You can't tell someone who got a broken limb to start jumping a rope.
Yeah.
Okay? Yes. So these are
you can't even tell someone who is 200 kilograms.
You see.
Yeah.
But also when you are starting exercise, viewers, don't start on high gear. You are going to get muscle pain.
Okay.
You are going to get fatigue. So start small as you are stepping up the exercise rate and the time.
Okay.
But exercise is a very big discipline to achieve. Someone is going to be committed for 2 days and drops, comes back next week. That's not exercise. It's not going to help you to cut down the weight. What kills most people who go to the gym is that after gym they have burnt a lot of calories. The body is in demand. They come and sit on a full plate of food. You are not helping yourself. You are not. Because why are you going to the gym?
To cut.
To cut. But what you've cut,
you've replaced. So you've replaced what you've cut.
So it's a discipline, right?
Yeah.
You know what to eat and in which quantity and quality. Yes. But exercise is a very good thing. Then also checkups, as I said. If you're in the risk group, 3 months, go and have a checkup. Go and have a checkup. If you are on treatment, take medications as prescribed
by the doctor.
I know out there are so many. I am not going to criticize people who take non-pharmaceutical. These are the medicines. No, I'm not going to criticize them. But be careful. Your livers also could get danger by whatever. I'm not going to mention herbs, but I've come to the market and I've seen patients come to my office with different containers of herbs. They have been telling them they cure diabetes. But some of them, not all of them, can even put our medications within those herbs. So therefore you are taking ignorantly, but you are taking our medicines in herbs. Yes, I've seen them come to my office with containers. Yes. So be careful whichever herb. But if you are prescribed medications, take them as given. And it is a very sad news to tell you that diabetes does not cure.
Diabetes does not cure.
Yes.
So
the medications, the prevention is to delay the complications of diabetes. As I told you, that you can lose your limb, you can lose your kidneys, you go on dialysis machines, that it can affect your heart, can affect your brain, can affect your eyes. Because if you have lost your eyes, you have lost your eyes. So the checkup also goes for the eye checkup. Then they check your eyes. For the medical personnel, they have developed a habit of checking diabetic patients. Check the eyes. Please, it is so absurd. You have been managing the patient, but he's now no longer seeing. Yes. It's absurd. The heart starts failing because you didn't do some small tests like ECG for these patients. So you're on medication, take your medication as prescribed.
Okay, our dear viewers, it has been a nice session. Unless you have questions to comment on for the doctors that will watch this, anything that you have to add on, please add it on in the comment section and share with those patients that you know that they are affected. I know there are many patients on who are diabetic. It is important to note that even mothers, every mother should be screened onto for diabetes during antenatal, so that the child can be protected at birth, because we see the consequences. And it is good to know, because we've been saying, and even the community has been saying, that it is diabetes affects the old, and that is what has been in the community. They didn't know that the children can also be affected. It is good information that he has given us, but the take-home message: prevention is better than cure. So it is for the exercises he has given us. Actually, he has given us the preventive measures. Do the checkups at least every 3 months. However much you're not affected, however much you're not feeling the signs and symptoms he has said, do the preventive measures. He has said, let's do exercises. For the obese mothers, I see some people doing the awareness of fitness. For the obese mothers or obese people, they can be men also. So for those people, let's start doing simple exercises.
They graduate.
Yes, then you can go on adding. You can start by walking, then you start running slowly, then go on. And maybe you do the vigorous when you're used. You know, the heart also can also be affected. Just to get used.
Then those who are sick, check your feet every day and don't walk barefoot. Because as I told you, when your nerves are already damaged and you are stepping on a stone, you will not feel this is a stone, this is a nail. So the organism starts from there. All of a sudden you are seeing your foot turning black. That's gangrene. Eventually you go to the hospital, they're telling you
it's cut
off this part. So have a habit of checking. If you have a mother that is diabetic, a father, a child who is diabetic, check their feet and don't let them walk when they don't have shoes. And when they put on shoes, let them be good fitting shoes, not tight shoes. Yes. When they are so tight, also they break the blood supply, and then eventually the gangrene starts healing. Then those who have wounds and they are not healing, go to the hospital so that they help you on treating such wounds. Okay,
thank you for this episode. For everyone that has been watching, we love you, and you can share with a friend, because health is a priority. The reason as to why we are working is to maintain a good health relation. So you can share with a friend. Until we meet again in another episode, I'll say share.
See you, our viewers. Thank you very much. You have been so wonderful. Those who have not yet subscribed, kindly subscribe. Those who need more information, you can send in the chat, or you can come to Deaf Medical Center in Konge. It is on Rukuri Road as you're heading to the Zika. You'll find us and we shall offer you the best services.